Uh, my situation is I developed RSD, CRPS as a result of a podiatry surgery I had in the spring of 2007, and I actually had the surgery in my right leg, and in the recovery period from that I was always sitting with my left leg in a dependent position, and whatever condition I had in my right leg kind of shifted over to the left leg. And I've been dealing with swelling and it's mostly swelling whenever I sit in a supine sitting position ever since. So since spring of 2007, summer, I was medicated on a series of pain medications and vascular medications, and went through beer blocks, the spine or the whatever's put in the spine. Tried all those type of treatments. Eventually got to Dr. Spiegel last spring, so spring of 2010, came in and did approximately 25 hyperbaric dives, along with a minimal amount of physical therapy, and began some of the vitamin injections. And from that I had improvement in that my symptoms are always swelling when I'm sitting. I was wearing, which gets worse through the winter, living in Chicago, when I'm standing outside for the L train, the bus, go inside, sit down in the office and work long days, and my foot is swelling within a couple hours. So I have to wear compression stocking. After I came and did the hyperbaric in the months of March and April, came back to my office job, and I was able to go without the stocking for at least half of the day. And I had some significant improvement. I felt like it wasn't one moment, but I noticed it from when I left to when I came back. I had improvement. And kind of carried that through into the fall, went through another winter in Chicago. Things kind of get set back just because of the conditions around me and the work environment, the weather. Came back down here, asked Dr. Spiegel if I could continue some treatments. I've underwent an additional 10 hyperbaric treatments. I'll have a fourth multivitamin injection today, and I did 3 physical therapy sessions a week with Mike, and I can say I feel like the feedback or the positive feeling I'm getting right now is stronger as I leave than I did even last year. And I think the immediate impact I see is from the PT, where when I come out of the PT, for the next 2 days I'm feeling great. Mike left me with exercises to take with me, stretching, a lot of it's flexibility to try to keep things loose, where I've gotten so tight and restricted in the hamstrings and the thigh. And again, I've went through days where I don't need to wear the stocking, I'm not getting the swelling. I do need to keep moving, but after 4 years of dealing with this, what's mentally such a challenge, it's so nice to have like a positive response from some sort of treatment, and I've got that here, and I'm very pleased, and I'll be back.